Hello, dear colleagues. We continue to understand the work details, and now we would like to show you the logic that we put in when we decide to do total prosthetics as an example of a small clinical case. The fact is that in our practice we are faced with the fact that patients come to us with, of course, already quite advanced clinical cases that requires a lot of intervention. But on the other hand, there is always a certain distinction between the degree of intervention and expediency. How not to cross it, how to make it reasoned and clear, and what is the chain of this logic in general which confronts the doctor when making this decision. I would like to demonstrate this to you now. So we have such a small clinical case, but it's extremely difficult. But please note that this patient does not have only two front teeth. They are broken two front teeth, and the question is how to do prosthetics. Do we need to make only two front teeth and leave it at that? But if you look more closely at the pictures, you will see that it was not just an injury that led to a fracture. The fact is that the lower teeth actually enter the roots of the upper teeth. That is, there is such a tricky abrasion so that the lateral teeth remained more or less preserved, but the front teeth were erased so much that they began to break. This patient was sent to us by another doctor, and it was that type of unexpected abrasion. We expect that teeth were going on evenly, so we need to evenly increase the occlusal vertical dimension. But in this case, the situation is completely radically different. Only the front teeth are erased. So what is the algorithm of deciding about total prosthetics or local prosthetics? How we can halt a case? How much will the clinical situation allow us to do this? Because oddly enough, you understand that in the case that we see now, we have two ways. The first way is to increase the occlusal vertical dimension because we do not have a place between the teeth and we need to get this place somehow. Therefore, we can increase the height bite and thus get this space. However, if we increase the occlusal vertical dimension, then we need to grind off all our teeth. Second way, we may try to go apically or grind off lower teeth. In fact, we are very limited by bite. Therefore, once again, the decision on total prosthetics or local prosthetics will consist of the following points. The first is the clinical component. I highlighted it this way. What do we see? For example, if the patient has complete genitalism, has no teeth, it is clear that this is a total prosthetics, whether removable or non-removable variant it would be. A large number of lost teeth. The fact is that we cannot confine ourselves to prosthetic of those teeth that are lost. We need to include, for example, bridges, supplement something, change the height, bite, again, and so on. That is, we have several components that either allow us for a total approach to prosthetics, because we can't limit ourselves like sewing some flaps on a blackhead and solve the problem that way. Another point, generalized abrasion. When teeth are all worn out again, we return to the question that we need to increase the height of the occlusal vertical dimension. Changing the height of the bite requires again the inclusion of almost all teeth. We cannot do it only on those teeth that are affected. Aesthetic indications and orthodontic indications. There are two strange things that you might think. The fact is that aesthetic indications, why do I single them out in a separate group? The fact is that in my practice, patients are still more of an older age group whose teeth are really worn out. But very often on Facebook, on social networks, I see doctors demonstrate excellent, very beautiful crowns of young patients, most often it's girls, who grind off their teeth according to so-called aesthetic indications. The fact is that here too is present is only a very fine line. Often these irregularities, tooth turns, we can simply solve by orthodontic treatment. Therefore, this question of aesthetic indications for total prosthetics is still very relevant. The fact is that as soon as you or me shave down something, we received a product that has its own service life, guarantees, and so on and so forth. That is, we perform the irreplaceable interventions. If this treatment can be limited by orthodontic intervention, whitening, or some other non-invasive methods, then of course you need to think about it 100 times before puzzling with this issue, namely, grind your teeth. Orthodontics. Why is this also such an important aspect for evaluation by prosthodontists? Because unfortunately, after some orthodontic interventions, the total orthopedic work is required. The fact is that very often after lining the teeth, orthodontists can forget that patients must still chew with these teeth, they must close them. And here arises the task from the orthodontist to the therapist or the prosthodontist, so that these occlusal relationships must be rebuilt. They can be restored only by prosthodontics intervention. While in addition to the clinical component, colleagues, there is another component, the technical one. The fact is that the integrated approach of the analysis by the prosthodontist to make a decision allows you to prevent further mistakes. Why we are highlighting this component? The fact is that if you create a new bite, new jaws ratio, new teeth, your technician, your laboratory should work at a fairly high quality. And not only in this case the crowns fitting, baking, technical moments play a role. We understand that there are laboratories that aren't able to give out the level of quality that you would like to see. Therefore, this degree of responsibility should force you to work with a laboratory that will ultimately create the level of work that will be worthy, that will last for many years and won't cause problems for the patients, both from the technical side and from the clinical side, because you do answer for it. The patient doesn't come in a year or two and says, "Oh, you've handed me a bad technician." No, he comes to you and expresses certain requirements. Therefore, a question related to an interdisciplinary approach to a technical laboratory is linked with the result of future restoration and the result of future work, because if you're not confident in your laboratory or you've just started your practice and have not yet found that technician who can complete this order, so you need to think 100 times before acting totally, because your subcontractors, your contractors, your dental laboratory must be on a high standard, since the total work is difficult both from a technical and a clinical side. Financial component. Colleagues, once again, I highlighted several components and took this component to a large group of components about making decision on total work due to the fact that we should not focus on just one element. Otherwise, a mistake could be made. Why is the financial component so important? We all make money. This is important. If you're engaged in charity work, I'm happy for you, but at the same time, even if you are ready to do this work completely for free, you must understand that the dental laboratory needs the payment, and the purchase of materials, the work of your assistant, and the work of the entire dental clinic spend huge financial resources. Therefore, any total work, even if the price of your clinic is not very high, has a very high cost. Due to the fact that a large number of teeth are included in the work. Because of this, the price of work is quite high. And here in this financial component, of course, you can go in different ways. Because we certainly want the patient to stay with us. We offer him a different price range, different types of crowns. You see, already based on the price, we can offer different prosthetics. It can be either options related to removable prosthetics or ceramics and metal-free ceramics and so on and so forth. Lower prices can be detrimental to product quality because you, for example, cannot sell this work, you want to make it beautiful, you want to post it on social networks to make advertising with it, but the patient is not able to pay for the work of technicians. Some technicians in Moscow are more expensive than in Germany, and here is the price may be so high that not only the patient cannot pay for it, but you have to pay extra in order to do this beautiful work. Therefore, what you have to do, you send this work to the laboratory of a lower price level and get what you get. Thus, in this case, making decision on total prosthetics, the patient here again takes a huge place.